Good morning.
Good morning, Kristen.
Good morning.
Good morning, Trisha. Good morning, girls. Oh, guys, sorry.
Morning.
Good morning. Good morning. Okay, guys, before we start, any questions?
No.
Good. Let's see if we can. Continue. And we can say it's okay. The next word will be patty, which mainly is okay. We just mean either it's okay. Disease, or it's okay. Can be it's okay. Condition. Okay. No, I mean, it's okay. I want to take up, it's okay, 3 patties and put them together. One is going to be as okay, retino patty. Next one is going to be as okay. Let's say it's okay. Renal patty. And last one is going to be neuropathy. Now here it's okay, guys, the word retin, we call it as okay. We can mean it says okay that the O's I mean that's okay, just sure. It's okay. Combine vowels, so it's okay, the word retin. Mainly it's okay comes from the word retina. Which means yes, okay, is an area is okay in the back of your eyeball, at which because it's okay. This is the inside of your eyeball. We have an area here which is going to be as okay the retina, and pretty much okay in the center of this retina. That's where we will have yes, okay, what we call the optic nerve. Okay. So yes, okay, disease process, and yes, okay, that develops in the retina, what we call retinopathy. Now, likewise, now we all also know that okay, yes, the word ren is okay, yes, well, okay, it comes from the word renal, which is going to be as okay, kidney. Okay, so in a law, yes, okay, extensively, can mean it's okay on a large, and yes, okay, kidney disease can be referred to as renopathy. And the last one is neuro. Where we know is okay that is your nerve. Okay, so again, it's okay. We can say it's okay, nerve disease. Okay, now mainly it's okay, primarily it's okay, happens in conditions such as retinopathy is okay, God forbid, the worst that can happen is what to call as okay, retinal detachment. Okay. But what retinopathy actually is okay can lead to is blindness, and okay, that can be overnight. In worst case scenario, guys, okay, renopathy can lead to, yes, okay, renal failure. And neuropathy now, okay, although it's a broad term, okay, but the main thing that we will talk about here, also, okay, we'll mention here is that's going to, yes, okay, lead to, yes, okay, complete loss of sensation. Now, guys, the reason that I took these three up here together was that these were, yes, okay, three common complications of diabetes mellitus. So pretty much, okay, as one of the, or you can say, okay, the main reason that they want, yes, okay, keep somebody, yes, okay, diabetes controlled is mainly, yes, okay, to prevent any of these three, yes, okay, complications here from developing. Okay, because, yes, okay, uncontrolled diabetes mellitus can lead to either of these, or in worst case scenarios, okay, all three of these complications here. So you can say, okay, it can affect your eyesight. It can, yes, okay, affect your kidneys. And okay, that can also, yes, okay, affect your nerves. Did that make sense?
Yes.
Yes.
Okay. Okay. But you can say, yes, okay, any, yes, okay, pathy. Camellia, yes, okay, this means, yes, okay, a disease process that affects, yes, okay, whatever you had as the root word prior to the pathy. Okay, we can just take for an example as, okay, a few other ones. We can, for instance, okay, say lymph. I mean, let's go and say it's okay. And of course, okay, we have our combining vowel, which is going to be, it's okay, the O, and then we have pathy. Now, guys, our lymph is going to be, yes, okay. It is mainly, as okay, a fluid in the body that, okay, helps as okay, we can call as okay, the immunity. Mainly as okay, the fluid that's going to, as okay, be circulating in blood in vessels called lymphatic vessels. Okay, but ultimately, guys, okay, so at the end of the day, yes, okay, this lymph, yes, okay, will become a part of your blood. Okay, but it has, okay, as its own set of blood vessels, and at different points of those blood vessels, okay, we actually have what we call, well, okay, we actually, okay, call them lymph nodes. Is one. We also, okay, we'll have, okay, what we can call as, okay, lymphatic glands. Whereas the thing says that your tonsils is one, thymus, the spleen is another one. Okay. But here, yes, okay, the nodes mainly, yes, okay, will be, yes, okay, what we call the aden. And then pathy. So mainly, yes, okay, any disease process that involves your lymph nodes. Or, yes, okay, in worst case scenario, yes, okay, lymph glands. Did you guys get that?
Yes.
Yes.
Okay, so when we say yes, okay, pathy, it is, well, okay, it's a broad term, right? Okay, and okay, what can happen here to these? We can take another one. This is okay, cardi. Oh, and then we just go mile. And then we just go, yes, okay. So what would that be? Yes, okay, a disease process affecting or involving the muscle of the heart. Okay. Okay. And what we will, yes, okay, or we will actually, yes, okay, realize later on is that, okay, yes, actually, yes, okay, structure a part of the heart that actually, yes, okay, causes the heart to be able to, yes, okay, push the blood, or as we will call it, okay, pump the blood, is due to, yes, okay, the action of the muscle. The cause is going to be the muscle that contracts and push onto the blood so that it can go in one direction. Did you guys get that?
Yes.
Okay.
Yep.
But then comes the reason, okay, as what may have led to, as okay, cardiomyopathy. Well, okay, there is an ocean of reasons for that. Well, okay. Okay, that can be something that's okay, electrolyte imbalances, that can be different things. Okay. That can be actually, as okay, actual damage to the muscle itself that may cause, okay, yes, that it is going to be, as okay, be diseased. Okay. Okay, guys. Now, any questions?
No.
Good. Now, guys, next word will be RHEA. RRHE. And in simple terms, guys, that means, yes, okay, that's going to mean either flow or, yes, okay, simple discharge. Okay. In some cases, yes, okay, we may also say, yes, okay, this discharge is going to be, that's okay, running. And that's very, yes, okay, now I already mentioned this fellow here. Okay, yes, we said Rhine. And of course, we're going to have, okay, it's a combining vowel, and then we have urea. Inca. Okay. So this means, okay, going to be as okay, running nose. Yeah. We can take another one. Now, you might have heard me using, it's okay, a word such as diarrhea. Now, here we can say it's okay. In this case, okay, the word diarrhea, okay, the word rhea would mean discharge. And what did dia mean? Yes, guys. Is there anybody who remember what dia meant?
To know?
Huh?
To know?
Nope.
Complete.
Complete. Angeles, I know that you talk about as okay diagnosis, but here it's okay was the gnosis that meant to know. Or it's okay knowledge, where die just meant complete. Okay. Is that clear, dear? Is that clear?
Yeah.
Good. So now, yes, okay, then you can say, yes, okay, that may give, yes, okay, the word diarrhea a whole different meaning. Or the no, yes, okay, when we say diarrhea, we actually, what we actually mean is that's going to be, yes, okay, because of loose motions. Okay. But we can mainly say, okay, at the time, that's okay, where this term here is okay, was made. That's okay. There really wasn't probably as okay any treatment for treating the loose motions. So that's okay. Once the patient is okay, met up to the doctor or whosoever was, they're just okay, try to treat. He or she was okay, is completely discharged from fluids. So that's why they is okay called it that. Okay, but you do what just okay mean yes okay the loose motions. That's okay, you're completely dried out and finished. Okay, that's that could probably yes okay be the reason yes okay from where yes okay the word diarrhea comes from. Now we can just okay just take another read. Menorrhea. Again, it's okay. Here it's okay. We can say okay. This means it's okay. Yes, either it's okay. Regular flow. Oh, yes, okay. Even it's okay. Discharge. Where the word meno, it's okay, comes from menstruation. So when you say menorrhea, that's mainly as okay. That's going to be used to as okay or reference as okay normal menstrual flow. Or as okay, what some people mean as okay, that's what call it okay, a regular menstruation cycle. Is that clear?
Yes.
Good. Now, if you put an A in front of it, that's going to then mean no menstrual cycle. And then you can say, it's okay, that's when you just mean you will go and say, it's okay. That is missed. Okay. So it's okay, mean it's okay, no menstrual flow. Okay. Now, guys, if you just says okay, look at our next term. In this case, so we can yes, okay, so let's go and see. It's okay, we did this way and see. Mano. Now that was going to be it. Okay, yes, it's okay. Menstrual flow. Now our next term is going to yes, okay, be what we can call it as okay. Reg. Or we may even yes, okay, see. Regia. Where he says, okay, regia, that's just become okay, the condition of rage. Sorry, which is sorry with okay 2 hours. Sorry, guys. Okay, so it's okay. RR. Sorry. Now, guys, when we say it's okay, rage or regia, it's going to be yes, okay. bloody discharge. And yes, okay, in some instances, okay, they may even say, okay, not just bloody discharge, but also excessive bloody discharge. And that's when we go, and if you, for instance, say, yes, okay, or same, yes, okay, manner, or replace the word ria with rage or ragia, for instance. We can say it's okay, menorrhage. Now, what that means is, okay, will become as, okay, as, or some people refer to as, okay, as heavy menstruation, bleeding. Okay, that's FA is okay. The word rage actually is also going to be as okay for as okay, heavy or excessive. Okay. So yes, okay, somebody who, for instance, okay, may have okay, heavy menstruation, that's not just going to be referred to as menorrhea. That's going to be referred to as menorrhage. Okay. That's okay. The excessive or heavy can be as okay in two ways. Partly is okay because it goes on and on and on for extensive periods of time. That can be as okay menorrhagia. And or if it actually is okay is huge amounts of blood that is being discharged just okay at a time. Both of them can be as okay considered to be menorrhagia. But the difference between them is that okay, as when it says okay, menorrhea is just going to be as okay regular menstrual flow, whereas you go menorrhagia, while okay, that's going to be as okay excessive bleeding. Okay. Did that make sense?
Yeah.
Yes.
Yes.
So please make sure that you know just okay the difference between these two here. We can then just say yes, okay. I mean, again, it's okay, just go with reg, or we can even, yes, okay, even if he says okay. Sorry. Regia. Okay. But when we put yes, okay, the words such as hemo. Now we can make this okay here, that's okay. Like this. So hem is just going to just okay be regular blood. O is mainly as okay, just your combining vowel. And you should say a rage. It's just going to be it's just like a bloody discharge. Or you say okay, hemorrhagia. That's okay again, that's okay, a condition of bloody discharge. But when we say it's okay, hemorrhage or hemorrhagia is mainly it's okay, just going to be in plain English language is what you would call a bleeding. Okay. Okay. So that's okay. Although is that clear? So whether you say it's okay, hemorrhage or hemorrhagia, or you can say it's okay, hemorrhagic. It's just going to be as okay, straightforward bleeding. Did you guys get that?
Yes.
Yes. Yeah.
Good. Okay. Now that everybody peed this morning. Good. Dr. Tracy. Okay, I guess Dr. Tracy doesn't want to talk. Now, guys. Because okay, now we are as okay, mainly as okay, back to as okay where we were yesterday. Okay, where we say as okay, you're. Now here as okay, this you're in this instance as okay, I was going to as okay be pertaining to urine or PP. There is reference as okay. Just to make it simple said, EA was we could say as okay would be as okay a condition of urine will be as okay what we'll call urea. Where then we on the other hand say it's okay. Emia was okay as again as okay a condition of. By condition of what? Blood. Clear? Now, guys. So, what different things that we could have in blood? We're going to be as okay, so on, so on, so on, so emia, so on, so on, so emia, so on, so on, so emia. And now we can say, okay, if things can show up in blood, well, okay, yes, they can also show up in the urine. Okay. Okay. Because okay, anything that you end up as okay having in the urine, mainly it's okay, might end up in the urine because it's okay, it first was in the blood. Now let's just put some other yes, okay, different things into the urine and say yes, okay, what the blue will recall then. Okay. Now our favorite one, as we had yesterday, was hemat. Right, hemat is okay. If you go back, you can say it's okay, that would be blood. Blood where? Or condition of the urine in which you find blood in the urine. Clear? Now, guys, yes, okay, this hematuria here. Yes, okay. We can mean this as okay. That I can, yes, okay, be 3 varieties of it. One is going to be, yes, okay, what we will call, yes, okay, microscopic hematuria. Okay. Now, microscopic hematuria is mainly as okay, while the urine looks normal. You may not know that there is going to be yes, okay, traces of blood in it until yes, okay, it is seen underneath the microscope. Nowadays, they may not even yes, okay, go with microscopic as okay, check the specimen underneath a microscope to detect whether there's blood on it or not, because it's okay, this can be detected by those urine sticks. Clear? Okay, you say, well, okay, how is there blood in my urine? It looks pretty normal. I didn't see any, okay. Yet, yes, okay, a red color that was, okay, would look like, okay, yes, as we had blood in it. Well, okay, yes, there were traces of blood in it. The opposite to microscopic hematuria is going to be what we can call macroscopic. And in many instances, guys, you actually will see that yes, well, maybe this was the urine, but it is heavily stained with blood. In some cases, it may be so heavily stained with just blood that as the urine doesn't look like urine, but it means it looks as blood. And though no, not really, yes, it's not really hematuria, and that's why it says it will be false hematuria. That's mean it's because it's the urine specimen maybe it's contaminated by blood from menstruation. So it's girls, if you at any point it's submit a blood sample and they see, even if they see it's microscopic, they may come and ask you, well, are you currently having your period? Because that might as those are traces of blood in the urine sample may actually be due to you having the period. That just means that's going to contaminate. But of course, that's that needs to be followed up on. But you may maybe ask us submit a urine sample in case that yes, once the period or menstruation is over. But guys, hematuria is going to be a condition of urine. Anyways, there's blood in the urine. Did you guys get that?
What does the bottom one say? I'm sorry.
False. It's a
Okay.
false.
Thank you.
Okay. And why is it false? Mean it's because the blood that was seen was not due to actual hematuria. That was mainly you can mean that the specimen was just contaminated by menstrual blood.
Thank you.
Okay. Now another urea. Now yes, I said yesterday that yes, we could also have what we call glycosuria. This glycose here is mean yes, from glucose, which means will just be that's a fancy word for sugar. So presence of sugar in the urine. And again, yes, nowadays they mean yes, just get that by yes, what you call it, yes, those yes, urine sticks. But the question goes, yes, why would you have sugar in the urine? That does mean it's most likely because of hyperglycemia. Heavy amounts of sugar in the blood. As some of it is going to be be discharged into the urine. And guys, bacteria is they have a sweet tooth. So people is will have a glycosuria. Primarily is due to hyperglycemia, which will be giving them as diabetes. Are also going to be prone to have we can say frequent UTIs. Because as I say, it's bacteria have a sweet tooth, so that's
How does that cause UTIs?
Pardon me, dear?
How does that cause UTIs? Like a
Because I said it. Bacteria have a sweet tooth.
so it's just because of the bacteria, like the
Exactly.
bacteria.
They
Okay.
flourish. They flourish or they live in large.
Oh, okay.
Okay. It's just like, okay, as letting a child into a chocolate store or candy store. Okay. So yes, okay, they live in large. And okay, as that sweet environment. That's also one of the reasons that okay, as people with diabetes have poor wound healing, or one of the reasons. Because yes, okay, the bacteria is okay, they are well fed. Because they have a sweet tooth.
So if you have diabetes, you have more bacteria in your body?
No,
Okay.
not necessarily.
Okay.
It's not that. But you can say it's okay, they are more robust. Okay, why? Because they are more well fed. And now you may say, well, okay, well, I just took a shower this morning. How come? Now the number of body cells in your whole body is exceeded by the number of bacterial cells that you have. Now you can then say, okay, good, bad, that's a whole different discussion. Okay, where good bacteria will be your normal flora, bad bacteria will be as okay, the ones that can lead to diseases. But if you do a count of your body cells versus just okay, the count of okay as bacterial cells, there's going to be more bacterial cells than body cells. Oops. Okay.
Is that the same for both types of diabetes?
What do you mean by saying so both types of diabetes?
Like type 1 and type 2?
Yes, because the only difference between type 1 and type 2 is in type 1, the person doesn't produce insulin at all. So what is he or she going to be dependent upon? There's no way around but to take insulin. In type 2, the person still, yes, okay, he still produce or she still produces insulin, but then insulin may not be enough to manage his blood sugar. So what can be two things? You may either, okay, reduce the sugar intake, right? So that, okay, your blood sugar just stays at, okay, at a normal range because good is good, but then too much good is bad. Or yes, okay, they take certain medications which either directly or indirectly, it's okay, may help the insulin to do its job. So that's why we have, okay, these oral medications that people can take for diabetes. Okay. So that's the main difference between type 1 and type 2. So in type 1, there is no way around. Well, okay, your body is not producing any insulin. In type 2, yes, okay, it does, but maybe yes, okay, it's not enough. Maybe yes, okay, enough. Why? Because yes, okay, the person is consuming too much sugar. Or what we actually is okay, it's been known for quite a time now, but that okay, certain people is okay may become what you can call is okay insulin resistant. They are producing insulin. It would have been enough. You can say, okay, keep their blood sugar in that healthy range. But mainly because, okay, their body is resistance towards that insulin. That, okay, the insulin is not going to be able to, okay, do its job efficiently, which causes that, okay, the blood sugar still remains high. And reason number one for that is obesity. And then you can argue, okay, was it the egg that came before the hen or the hen that came before the egg? Because, okay, then, okay, one of the, well, okay, other complications of obesity, diabetes is mainly obesity. So then, but then you can say, okay, well, did the person get obese because he was diabetic? Or did he get diabetic because he was diabetes? Okay. But okay, what they have found in okay, as a result of studies is that okay, yes, what obesity is okay uh, may lead to is okay what they call is okay insulin resistance. So yes, okay, things and okay, yes, so and so yes, okay, change. Now, what else can you find in the PP in the urine?
Potassium.
Huh?
Potassium.
Potassium. Okay. Now, what was the term for potassium?
Isn't it KAL?
Okay, kaliuria. Now, ideally not. Okay, ideally it's okay. You shouldn't find it's okay potassium in the urine. As a matter of fact, it's okay. Most salts or minerals, that's okay, shouldn't be found in the urine. Not to talk about okay, you should not find it's okay blood in the urine either. Okay, what the urine main is okay is to get rid of what we can call as okay metabolic waste. Okay, so that's okay. Something that can be as okay, and again as okay, of course, shouldn't be found in the urine. But if we see it, well, okay, yes, proteinuria. So that's just going to be as okay. We can say okay, proteins. That's okay in the urine. Now, guys, I just okay. If somebody is okay have protein in the urine, that should yes okay. That's a big red flag. Primarily because okay, the protein are so large molecules that they shouldn't be able to just okay pass through yes okay the filter or filters of your kidney. If they do, or you can say okay, you end up seeing yes okay protein in the urine. That mainly means that okay, yes, the filter of your kidney is damaged to an extent that it actually is, okay allows the big molecules of protein to pass through. So earlier, as okay, when for instance, as okay said, renopathy, that could as okay lead to that. That the person actually like me as okay lose heavy amounts of protein in the urine. Known as proteinuria. Now, guys, what else do you think is it that you can find in the pee-pee?
Calcium.
Okay, let's get free from minerals and salts. Okay, calciuria. Okay, then what about natrium or sodium? Natriuria.
You can find drugs in urine.
Okay, so what is that going to be called? Cocainouria, marijuanauria. Okay, or chemouria. Ah, okay, guys. Now I may say something that is, and some of you will go and say, okay, but Mike, how in the hell does that end up in the urine? Now, guys, new. What was new? What was the meaning for new?
Air or lung?
Wow, okay.
Was
It's
it
going to
air or
suck if
lung?
you start seeing yes, okay, your lung in your urine. Okay, well, okay, here it is mean yes, okay, there's going to be okay, a little unusual of okay, yes, because it can pertain to. So air in the urine. Now some of you may ask, how does the air end up in the urine? We are not talking about oxygen. Okay, guys, that's fine. Look, this is okay, mainly the organs is okay, because okay, your urinary bladder. Now this air here is okay, needs to come from somewhere, right? Now what is it that we mean? It's okay, have right next to the urinary bladder.
Is it gas?
Colon.
Oh boy.
Now, guys, what may happen is that okay, yes, due to whatever reason, that the actually is okay ends up just okay develop a connection between yes, okay, in this case, okay, the colon and the bladder. This connection here is okay, that's what we is okay, we'll just refer to as a fistula. Now we talk about okay, some fistula later on. Okay. And whether you like it or not, but that's okay, what you actually is okay, we'll have in the colon along with poop will be air. And that area is okay, may enter into the urine. So what you may is okay see is okay your stream of urine. Maybe as okay bubbles of air. So that will be as okay, pneumaturia. Now that's okay. If the air can pass, okay, so can okay, it's a little piece of poop. Oh, that's okay. Smaller, bigger piece of poop material is okay. Also pass into the bladder. And okay, the word for poop is feces. And from feces comes fecal. And okay, yes, that just becomes okay. Or you call it okay, a feculate. So that piece of poop may is okay. Not stones, okay, but okay, yes, may is okay. P is okay, stones. Or turn into something that may look like a stone. And of course, that's okay, guys. This here are feculates. Okay, that's okay, B, that's okay. UTI plus UTI plus UTI plus UTI. Because okay, a big or small is okay, feculate. It's in the bladder, which means okay, it just causes a infection to come back again and again and again and again. Because guys, one of the common bacteria that leads to yes, okay, UTI. Have any of you heard of a fellow called E. coli? Okay. You can
Yeah.
say it's okay, 90% plus of bladder infections are due to E. coli, which is okay as a normal bacteria in your gut. But it's okay, it belongs in the gut or in your colon. It doesn't belong in your bladder. Okay. So that's okay. In some instances, okay, it may not be as okay diabetes, but that's okay a feculate. But that's okay, of course, that's okay. That's going to be more rare. The proper is okay. The common reason that it's okay. People may get okay as recurrent UTIs due to it's okay. E. coli is primarily because they wipe themselves the wrong way. Okay, now you guys are okay as adult people. And not going to be appropriate for me to yes, okay, start telling you yes, okay, how to wipe your butt. Okay, but you can think yes, okay, what the wrong way will be. Okay. And the rest I can just leave up to your imagination. So that's okay. Don't just okay, and never think that okay, that is not possible. So okay, you go to have air in the urine. Okay. But then again, it's okay. Now we can also say it's okay. What would be another thing? It's okay. Not really it's okay related to it's okay what you have in the urine, but it's okay me. It's okay just the condition. It's okay related to it's okay your urine, or rather it's okay a symptom. And we already talked about this one here, right? Or if you put it's okay one and one together, it's okay a condition of urine in which there's going to be poly a lot. The patient pees a lot, right? So that will be polyuria. Did that make sense?
Yes.
Right, okay. Now, since we are at the polys, again, yes, okay, we can just say it's okay, they're going, yes, okay, going to be, yes, okay, 3 polys. We have, yes, okay, 3 polys. Again, that are going to be, yes, okay, pretty much okay as symptoms for, yes, okay, your diabetes. And one is going to be, yes, okay, what we can say is, okay, will be polyphagia. That the patient eats a lot. We may also say as, okay, since he eats a lot, okay, he or she may also is, okay, pee a lot. And one of the reasons that he or she may be peeing a lot, first of all, like, it's actually it's okay because a lot of the glucose that he or she consumes never makes it to the tissues because it stays in the blood. And what glucose has the tendency to do is pull onto salts. And what salts have the tendency to do is pull on water, onto water. And okay, of course, yes, okay, that water is going to be, yes, okay, excreted out. Okay. But it's okay, mainly it's okay because the patient is okay, may pee a lot. He or she is okay, loses a lot of water, and that's why it's okay, they will have what you can call is okay, polydipsia, which is going to is okay, a lot of thirst. Or you may say it's okay, drink a lot. So these 3 polys here, yes, okay, are that's okay, 3 common indicators that okay, yes, the patient may have diabetes. Okay. But somebody shouldn't go and say, well, okay, right now you're only peeing a lot, you're not eating a lot. And okay, the patient may not complain of, okay, has too much thirst. Let's wait for this to come. Let's wait for us, okay, this to come as well. And then it's okay. Either of these, yes, okay, should be, yes, okay, ringing a bell. Okay. Any other urine condition or condition pertaining to urine or related to urine or PP? No? You heard enough of urine? Okay, guys, this is just the beginning. Okay, let's take one last one. And of course, that's okay, it is going to be urea, condition of urine. Nocturia. And what does the word noct means?
Is that night?
Night. So nocturia, guys, is mainly as okay when the patient wakes up in the night to pee. Okay, that would be nocturia. Not bedwetting or peeing in the bed. That would not be nocturia. That's a whole different thing. Okay, so like he or she pees in the night. Okay, but yes, okay, here, of course, when you say it's okay, nocturia is okay, the patient most likely, yes, okay, will get up in the night and yes, okay, go to pee. Do you guys know why most people, yes, okay, may end up peeing in the bed?
They have a dream about it.
They have a dream about what?
Going to the bathroom.
And they think they are in the bathroom. And that's when they just go, okay. And they wake up and they didn't know. They say, okay, I thought I went to the restroom last night. Woke up in the middle of the night to go to the restroom. Okay. So yes, okay. How do you treat that? How
Don't
do you
drink water before bed.
okay. That could be one way. That tells them that okay, sweet dreams is not just okay, dreaming about going. Okay, that's okay. It is, and but like I said, that's okay. It means it's okay. People may it's okay. Just grow out of it. But it's okay. So there was okay some certain ureas, which for us okay conditions are as okay related to your what the we call it um urine. Okay, guys, is there anybody who like I have any questions about the ick, l, eel, r, airy as suffix? Okay. So yes, okay. Why use one suffix contrast to another, contrast to another, contrast to another? Well, okay, yes. A mean yes, okay, just sounds good. Okay. Okay, just take a short break. And when we come back, yes, okay, we can start talking a bit about yes, okay, some of the procedural suffixes. Okay. Some of most of them, yes, okay, already have mentioned in okay, so our previous discussions. But that's okay, there are some suffixes which okay, yes, we may not have talked about as okay as procedures, and okay, yes, we'll check this up. So I see you guys, should we say at 10:20? Is that fair? Okay, guys, have fun. Okay, guys. Okay. Any questions yet?
No.
Nope.
So let's just talk about as okay some of the what we can call it um procedural suffixes. And when we say procedural, that means it's okay, going to be is okay that these are referred to a procedure, or yes, okay, in some cases it's okay, even what we can call is okay, a process. Okay, which means it's okay will be performed on patients. Now the first one. Now we mentioned that yesterday. And okay, that's the reason that we know that it is a procedure or process is because it ends with cis. We mean it's okay, you can say it's okay that the whole term is okay, synthesis. Now we can say it's okay, it's going to be it's okay, a surgical puncture. Okay. We may even it's okay say that okay, yes, also it's okay to remove fluid. And another word that can be as okay used, which means the same as okay, remove the fluid. Is going to be as okay, aspire. Okay. So guys, let's just think, okay, yes, where can somebody as okay develop fluid? Now there's a pretty broad term, and we can say it's okay. Generally speaking, it's okay. That will be it's okay. What we can call is okay, thorac. O synthesis. But we mean it's okay. Let's consider okay here the thorac came from the word thorax, which mainly is okay as a whole is okay. We just refer to as okay, your thoracic cavity. O is mainly as okay, just your combining vowel. And synthesis will mean yes, okay, this means okay, a procedure of removal of fluid. Now here it's okay, it is not specified as okay which area in the thorax that it is going to be. So that's the mean as okay, that's a big broader term. Okay, where okay, as if you go specifically, you know, say, well, okay, this thoracosynthesis could be as okay, plural synthesis. That means okay, just be as okay, specifically as okay, remove fluid from the pleural cavity. Or from the pleural membrane. Okay. Now whether that fluid was made as okay, plain pleural fluid, or whether that was okay as blood, etc., etc., etc. Okay. Did that make sense?
Yes. Isn't amniocentesis one?
Yes, but let's take one at a time here, okay? Okay. Another way of okay, so because it's okay, another type of yes, okay. What the blue is it that you call it? Yes, okay. Thoracocentesis could be yes, okay. What we're gonna call it? Yes, okay. Cardio. Okay. Synthesis. Now it's okay here. It's not really going to be the cardio, but actually it's okay from the pericardium. Okay. Where the media is okay, aspire is okay, excessive amount of fluid from yes, okay, the pericardial cavity or from the pericardium. Okay. Okay, now since somebody really wanted to talk about it, okay, we can go and say it's okay. Amniocentesis. Now where it says okay, this amni is okay, mainly it's okay, just it's just short from it's okay, the what we can call is okay, the amnial sac, which contains what we call as okay, the amniotic fluid. Okay. So guys, that's okay, where is the amniotic sac? Now we can say, okay, that was the first room in our first house that we were living in. And we can say, okay. It is, for instance, okay, was the uterus. Within the uterus is going to be, yes, okay, this amniotic sac. And within this amniotic sac is going to be, yes, okay, the amniotic fluid. And within that, yes, okay, that is, or is okay, yes, the futurus. So amniocentesis mainly as okay will be a procedure by which the media is okay now, it's okay. It okay as most likely as okay needless range as okay will aspire obtain a specimen of the amniotic fluid. Okay. And guys, mainly because okay, you don't really have much room. That's okay. I just made a lot of room. But that's okay. In real life, that's okay. There's not going to be much room. That's okay. Yes, okay, where the needle freely can be moved into, yes, okay, into the amniotic sac. So that's why it's of course, that's okay. That is what should be done. And there's okay the view of an ultrasound. So it's okay as you for instance, okay, we'll be scanning. And you may actually be able to see it's okay, this whole thing here is okay on your image. You may see it's okay, the fluid. Now guys, just keep in mind the fluid is going to just okay appear black on your scan. And in all that, that's okay, you may see junior, but that's how that's okay your image is going to look like. And okay, eventually that's okay when somebody is okay will introduce that needle, you may just see that's okay coming into the picture like this. So that's okay, that's how it's going to just okay end up looking like. Okay. So they was okay, well, okay, we are in the amniotic sac. There's no point of okay proceeding any further because a slight movement may actually just okay cause this needle just okay hit the fetus or embryo, as we may call him, and cause damage. Okay. Now, this is another procedure that is free from risk. Now, some of you may ask, why in the blue would they do something like that?
They do it for like genetic testing.
Genetic testing. What is a common disease
Down
that they
syndrome.
may? Huh?
Down syndrome.
Down syndrome, right? Okay. But is everybody who is getting okay, yes, okay, meeting up in an OBGYN because they're pregnant, are they going to be getting okay as amniocentesis for Down syndrome? Now, what they have found is, and that's mainly as okay, and that's one of the things that they may as okay check for as okay during some of those what you want to call it as okay prenatal scannings is what they call as okay the knuckle fold, which is okay as a fold in the neck, where the word nuch N-U-C-H is okay as another word for neck. AL is just going to just okay be pertaining to. But if they see that, that may be as okay a possible sign of that the child is developing Down syndrome. But it's not confirmed. Let's put it this way. So that's okay. The genetic testing will be as okay a more of a, you can say a confirmation. Okay. But that's okay. One of it's okay. You can say it's okay findings that can be seen on an ultrasound that may suggest it. Okay.
They also check for spina bifida too.
Mhm.
Yeah.
Yeah. But okay, there's a lot of things that they can check for. Okay. And okay, either something may be known before the birth, which mainly as okay, me as okay, I guess that's okay. Enable as okay the personnel to as okay plan the delivery. And okay, yes, whatever we our precautions and so on. So may need to be taken yes okay during the delivery. Okay. Now we can say it's okay synthesis of okay as your cerebrospinal fluid. That is what we just call plain straightforward lumbar puncture. Right, okay. What about synthesis of blood?
Hematocentesis?
Okay.
Chemosynthesis?
No. There's no synthesis in that one, right? Okay, it's plain, yes, okay, phlebotomy. Or what we may, yes, okay, just also refer to as venipuncture. That's where they go with a needle, yes, venipuncture.
Are you saying
Puncturing,
puncture?
exactly. Okay. Puncturing of the vein. And then you have your finger sticks. What do they call those? What do they call those when they obtain specimen of blood from your fingers? No idea. They may either call them capillary punctures or dermal punctures. Okay. And then there's one that we call arterial puncture. Now, guys, when you go for regular blood work, they mainly just obtain blood from your veins. So that's that will be a phlebotomy or venipuncture. Right, okay. Arterial puncture, yes, that is only in emergency situations that will be done. And it's according to the book, not everybody who is allowed or entitled to be able to do arterial puncture, where they actually want to obtain blood from the arteries. But that's a pain in the butt. So yes, okay. Yesterday I talked to you guys about a false alarm, right? Because we had the emergency testing. That was when it actually beeped. Now one of the off the record, guys. Okay. Because these are cheer punctures. Yes, you were standing. Yes, the needle is in, and yes, you pretty much yes poking the patient blindly. So yes, in many instances, it's just mere luck that you actually managed to hit the artery. That's where they may go in. Pull the needle out a little bit. Okay, let's go this way. Let's go that way. So whenever I used to hear that as the doctor or the consultant sitting at the desk behind me or station behind me, we're talking. And this might lead to that this patient may need an arterial puncture. Because what was it that they will usually do? That consultant told me, "Oh, we got Mike here." Or it could have been anybody, but it's okay. I want to know what happened to other people. Okay. And they will say, "Okay, Mike, you don't mind doing an arterial puncture?" I says, "Okay, no, I don't mind." Of course I mind because that's a pain in the butt. You're standing there and it's trying to hit that artery blindly. So what would I do while they were having that conversation, which I from experience would know that that would probably lead to an arterial puncture. No clue. I will call my beeper. Call my beeper from the phone. Pick up my beeper and say, "Okay, yes. Chest tube? Well, okay, I'm there." Then they could look for somebody else who has do that arterial puncture. But for how long? For how long should I be able to Because at some point it's they say, "Okay, Mike, you are going for a chest tube?" I say, "Yes." And the consultant will say, "Okay, you know what? I take care of that. You just deal with the arterial puncture." And now I have to make up a chest tube, right? Because is there somebody somewhere who needs a chest tube to be passed? No. So okay. False alarm, I guess. No. Yeah. Okay, guys. Okay. see. Now, guys, any questions about the ectomies? I think we have talked about it's okay to remove any possible thing, right? Okay. Okay, just one ectomy that we haven't, that's okay. Haven't talked on or about on Zoom was what I mentioned yesterday, especially. It's okay when we went over that list of words was okay as what we call is okay oophorectomy. Where this one means is okay, just removal of. Okay. And it's okay here, it's okay, the O was the ovaries. Okay. We could also have, okay, yes, a hysterectomy. Which means, okay, this will be as okay, removal of the uterus. Right, okay. What else can we remove? If we just stay with, okay, yes, the female, yes, okay, we can say, okay, we have a mast ectomy, removal of the mast, which in this case it will just be as okay, the breast. You can remove the, what else can we remove? Let's say, go guess. Coli cyst. Ectomy. And this again is okay, still was okay, the removal of. That's okay, what we call is okay, the bladder. Or this bladder is okay, the gallbladder. Okay. And guys, well, okay, yes, of course, there's also something that is called, yes, okay, cystectomy. And some of you may go and say, Mike, is that for real? That they actually is okay, may remove, yes, okay, the urinary bladder. Or cut it out. Yes. And then your question may be, so how does that patient pee? Well, okay, we didn't remove the kidneys. You will still be producing urine. Okay. Now, what you guys will realize, okay, yes, once we get to, yes, okay, talk about the urinary system. The urinary bladder means, okay, there's going to be a sac that stores the urine. But, okay, yes, what they actually is, okay, will be able to do is construct a urinary bladder using, as okay, some parts of, okay, some muscles in the pelvic cavity and construct an artificial urinary bladder with help of that. Okay, so that's where you mean you can say it's okay that the urologist, yes, okay, may you can say it's okay, seek the help from a plastic surgeon.
And it would function the same way as a normal bladder?
Yes, okay, with some training. Okay. But the main thing that you just, okay, what the bladder mainly is that's going to be okay, a reservoir storing on to the urine. Because had it not been for the bladder, yes, okay, will be yes, okay, mainly yes, okay, would have been peeing 24/7. Okay. Because your kidneys continuously, yes, okay, keep on producing urine. It only is okay when that urine is okay comes and fills up the bladder to an extent that okay, it's, you feel that okay, now it's so filled. That's when the pressure starts building. Okay. And that mainly is okay, that expansion of the uterus of the bladder is actually that's okay, it triggers the mechanism that mainly is okay will cause the bladder to contract. And okay, that's when you go, well, okay, if I don't make it to the restroom here and now, it's okay, I may end up okay, wet my pants, or it's okay, pee my pants. Okay. So you can say, okay, some of that control is involuntary. Some of it is the voluntary. So it's okay, once the involuntary is okay, functions of the control of the bladder is overcome. The only thing that is holding it back is because you are holding on to it. Which is okay. Okay. Now it's urgent. Okay. But yes, okay. They are able to, yes, okay, make a bladder from, yes, okay. But and that's why it's okay in this case, it's okay. It's better to leave, yes, okay, as much bladder material as okay behind as possible. You're going to say, okay, well, okay, probably not be able to just okay. You just will have okay, it's not the person most likely just will have to yes, okay, go to the restroom yes, okay, a little bit more frequently than he used to because his bladder is now smaller. Okay. So yes, okay, it is possible to take out yes, okay, the whole bladder. Okay, guys, now probably it's okay. One of you can say it's okay. The cruelest ectomies to do. What do you think would be here? And I say it's probably okay. One of the worst ectomies somebody may have to do.
Yeah, orchidectomy.
Ah, okay. You can still live a pretty normal life. With one ball or chesty. Probably a guy, okay, we can say is one of the most cruel ones. Ophthalmectomy. Removal of the eyeball. Or eye. Now, who may have their eyes removed? No idea. There's actually an OMA. Okay. You see, we talk about, okay, one word and it leads to another word. There actually is, okay, is an oma. That may require, as okay, an ophthalmectomy, removal of the eyeball. And that's what they call is okay. The retinal. And here's okay, it's going to be okay, a little other word that, okay, as we may talk more about as we when we go to the bones, for instance, is going to be as okay. Retinoblastoma. But it's okay, guys, since it's okay, although it's okay, it only ends with oma here, but this fellow here is a malignant tumor. Now, why is it one of the, or why is it the cruelest ectomy to do? Because, okay, that tumor of the retina, of the eyeball, is a juvenile condition. It affects children. So that poor child may, as okay, be one-eyed for the rest of his life. Now, you can give them a glass eye. That's going to just okay, just me. Okay, that's okay. This is okay. You can just okay dealing with the cosmetics. But that's okay. That eyeball is not going to be able to move. Okay. Okay. And not okay as he be able to just okay move that glass eye as he is okay move his other eye or her other eye. So that's okay. Retinoblastoma.
What does the blast mean in it?
Blast, my dear, mainly as okay, is a term that we may use for what we can call as okay premature cells. Okay, but I think yes, okay. The main is okay. Just squeezed it in here is okay. To make it okay, yes. Well, okay, it sounded a little more like okay. Although it's okay, there's not much chick about it, but anyways. But yes, okay. In okay, some later chapters in NP is okay, we may come across the word blast when referring to yes, okay, cells, which means yes, okay, or be yes, okay, premature cells. Okay. So yes, okay, the blast with a B with a boom is now of course yes, okay, we can also have okay, another ectomy. And that will mean yes, okay, just be nephrectomy. Okay, which is when yes, okay, where we mean yes, yes, okay, the nepher is just going to be yes, okay, for kidney. Now again, yes, okay, we also know that okay, yes, there's another word that means kidney, which is ren. But okay, again, yes, okay, nephrectomy just sound a little bit more yes, okay, right, correct, or sexy to say rather than renectomy. Okay, guys. Now you may also, it's okay, come across the word lobectomy. Where the word lob, L-O-B here is okay. It's mainly as okay, just a short for what would be lobe. Is that clear?
Yes.
Okay. Now then you can just go and say it's okay. Now that would mean it's okay. B is okay if you remove the lobe of an organ where you find lobes. Now, guys, usually it's okay when we use the word lobectomy as just lobectomy. It's in most instances okay for the lungs. Okay, whether you look for lobectomy, yes, okay, mean yes, okay, will just be yes, okay, lobectomy. Of course, yes, okay, you can also yes, okay, remove lobe of a liver. Yeah, of course, that's okay. That will be yes, okay, hepatic or hepatic lobectomy or hepatolobectomy, whichever. Okay, where the most likely is okay, then we'll specify as okay which lobe was removed. They can even say okay, okay. Even in lungs, that's okay. They may specify okay which of the lobes in which lung there was that we removed. But it's not going to be called as okay pulmonary lobectomy. So usually it's okay when this you see the word lobectomy, it means okay removal of lobe in the lung. Did you guys get that?
Yeah.
Yes.
Right. Okay. Now, guys, again, it's okay. An ectomy, which is not written in your book, but it's okay. It is possible. Oops, sorry. Okay, it is possible to, yes, okay, remove it. And okay, this ectomy is okay here may become more and more common. And that is what you, it's okay, we'll call, you can call it, okay, and atherectomy. Again, it's okay, guys, this ather here is from that atheroma, or what we call is okay, the fatty plaque. Now, guys, okay, as a common blood vessel where this is performed is in the carotids. First of all, it's okay. This procedure is okay. Currently, is well, okay. They are not able to perform it on very, 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 very small blood vessels. Clear? Okay. But why the carotids? That's one of the main arteries that supply your brain. And okay, if your brain doesn't get enough blood supply, then what's going to happen?
It dies.
Okay, good. That's the terminal stage, my dear. Even it's okay if I block the blood supply to your brain, not 100%, but okay, yes, 50–60% of the blood supply to your brain, if that is reduced, what's going to happen? Okay. I know that some of you don't watch movies. Now I also know that some of you, yes, okay, most of you don't watch, yes, okay, WWE either. All the guys, that's okay, that WWE, that's all fake. I know people here are fans of it, but it's all fake. This, what do they do? Or what's the whole thing that they fake that's been done? Blocking the
Sprinkle
carotid.
you.
Now what happens next?
Pass out.
Pass out. But before you pass out, what may happen then? You may be delirious. Oh, that's okay. You may be, it's okay. What some people make it, it's okay, lightheaded, and so and so. Okay. So, yes, okay, guys. If the brain doesn't get the blood that it needs, then okay, yes. So that's okay. But what may is okay, reduce that blood supply now. You don't have to be in WWE. You don't have to be in a fist fight with somebody. But even as okay, if there's okay as arteriosclerosis of the carotid, what's that going to cause? Reduce blood flow. Because part of the way for the blood is blocked by the plaque, it's okay, fatty plaque. Now they actually, it's okay, can surgically go in and remove those. So that's what you can call as okay, atherectomy. Removal of the ether, which is going to be okay, that fatty plaque. Okay. Of course, it's okay, it can only, it's okay, for that, at least at now, at present time, that's okay, we only do it on, okay, as big blood vessels. Any questions, guys?
No.
Okay. Okay, just, yes, okay, sorry. Oh, yes, okay, you guys will realize that, okay, it's okay, most of my time, it's okay, I've been, it's okay, in a surgical department. So we can say it's okay, colonectomy. Now, colonectomy is okay, that's a little bit extreme. Usually, it's okay, they may use the word hemicolonectomy.
Is that half?
Yes, my dear. Now, practically, okay, if you go word wise, the word half is okay, the word hemi or hemi means half. But even that's okay, removing half of the colon is going to be as okay a lot. So usually when they say it's okay, hemicolonectomy, that means it's okay, that's going to be as okay, what roughly as okay can be referred to as okay as a partial colonectomy. Okay. Remove a part of the colon. Is that clear?
Yes.
Okay. So even if it says it's okay, hemicolonectomy doesn't mean that okay, half of the colon is removed. Okay. But yes, okay, the word hemi is mean yes, okay, what it means half. There's another word that means hemi, which is semi. SEMI. Okay. Which also is okay means half. Whereas, okay, if you just look at the word colonectomy, it's okay, it will mean it says, okay, removal of the colon, which mainly means, okay, that the whole thing was removed. Now, guys, if the whole colon is removed, okay, well, okay, that's okay, still going to be, that's okay, colonectomy. But, okay, when they talk about, okay, the whole thing being removed, that's going to be, okay, pancolonectomy. And that's why it's okay. This means it's okay from here. It's okay that we got the word. It's okay. Pandemic. COVID was a pandemic, right? Because okay, it was pretty much okay. It's all over the globe. So yes, okay, to some extent. Whereas okay, we talk about it's okay a local problem. That is okay in a country and a state that is just going to be it's okay an epidemic. Where the word epi here is okay, mainly it's okay, so it's going to it's okay. We can say nearby or we can say it's okay in the surroundings. Okay. So that's okay if an epidemic spreads from okay, yes, from a country or from a local area, from a continent and become okay as a universal phenomena all over the world, pretty much. It will be as okay, that's the difference between an epidemic versus a pandemic. So it's okay, removal of it's okay, the whole colon. And usually, guys, okay, it's not only the colon that's taken off, it's also going to be the sigmoid, which is it's still part of the colon. The EOS okay may take off the rectum as well. And okay, as the anal canal. And pretty much okay, has closed the anus. Yes. So the patient doesn't have a butthole. Why? Because well, okay, as whatever is left of gut is mainly going to be emptied out into a stomy bag or that mouth look-alike opening. Okay, called a stomy-esophagus. Yes, okay, last end of the gut available, opening up through the skin. So I think we talked enough ectomies, right? Okay. Good. Okay, guys. Can you guys give me okay some other examples of some other pans? What can be some other examples of some other pans? Yes, guys. Anybody? Do you guys know of some other pans?
No.
No? Hmm.
Like pancreas, but I don't, is that,
Okay. I guess you never heard of this guy here. Have any of you heard of Peter Pan?
yes.
Yep.
Okay, good. What about him? Is there really a place called Neverland? Maybe it's okay in your dreams. And on Neverland, you never have to go to the restroom and pee. So it's okay. Done with, okay, as peeing in the bed. Because you never grew up on Neverland, right? So what's another pan that we can think of? Right, you may not even think it's okay. Okay, when we talk of Peter Pan, yes, okay. Well, okay, I guess somebody not don't know that, okay, there's something that is called a frying pan. Okay, guys, that's fine. Let's go to our next word. We can say gram. Now, gram is just going to be as okay, record. We can say it's okay, Grammy. If we say Grammy, yes, okay, that just become yes, okay, the process of recording. Did that make sense?
Yes.
Good. And usually it's okay when we say gram or that's okay. That's okay. This word here is okay. May also it's okay in some instances. Okay, be graph, which then just can be as okay. Be graphy. Okay. Now we said, for instance, or we can say mammogram. Or even yes, okay, mammo. Grammy. We can also yes, okay, use the word graphy or graph. Both of them yes, okay, will be correct. Because okay, in both instances, okay, what is that we get? Okay, yes. We get okay as an image. Okay. Yeah, okay. Most correctly, yes, okay, when we talk about okay, image would be yes, okay, graph. Just like we said, okay, yes. Radiograph. Just a fancy word for an X-ray. We call it X-ray as okay, mean yes, okay, due to yes, okay, the kind of waves that actually is okay were used to yes, okay, make an X-ray. They are called X-ray waves. X waves. Okay. Well, okay, as a result of okay the X-rays, you get okay as a radiograph. All these X-rays as okay were radioactive or radiations, if you want to put it that way. Now, what we are going to be doing is okay, we do sonograph. And that's why you mean it's okay whenever you see the word graph, it's me, it's okay going to be it's okay some sort of visualized recording. Whereas okay the word sono is from son, which means sound. So it's okay, another term for it's okay, ultrasound is going to be sonography or sonograph. So that's a generalized term for ultrasound. You may, it's okay, use another, it's okay, a specific type of, it's okay, I'll talk about, it's okay, a specific type of sonograph or ultrasound test, which is going to be, it's okay, an echo. Cardio. Graph for graphy. Graph is going to be, it's okay, the picture that we get. Graphy is just going to be, it's okay, because it's okay, the procedure of, okay, performing and or getting an echocardiograph. But here is okay, it's pretty much specific of which okay, it's structure that is being scanned. Because it's going to be an image or imaging test of the heart in which we use echoes. And what's an echo? Have any of you ever heard an echo? Yes, Christian. What is that echo going to sound like?
It's gonna like repeat itself almost.
Repeat itself. Where's that itself coming from? Where's that itself coming from? Okay, let's say that the echo says, or the sound that you hear in the echo says, the sky is blue. Who said that? The fellow standing over there said it or somebody else? No idea. If I say the sky is blue and that sound reflects back and says the sky is blue, that's going to be the echo. So you're pretty much, okay, I just hear the sound that you produced. And that's what is going to just, okay, be done in ultrasound. That sound comes from, it's okay, from your transducer. But it just goes and comes back. not just in an echocardiogram, any kind of just ultrasound studies that you do is going to be that transducer, that joystick that you are holding, that will be producing the sound, but sending those sound in waves into the patient, and they will mean reflect back. So all ultrasound system, all ultrasound exams are results of echoes coming back. Did that make sense? But that's of course, yes, the sound that you produce and the sound that you get back are going to be different. All dependent upon what structure it comes across. Okay, if that wasn't going to be different, then areas ultrasound had looked alike. But the whole thing is that as the sound that returns back to you, which in the real world we call it an echo. Okay. But yes, also yes, a reflection that just comes back. If that makes sense. So that's what we call a sonogram. So yes, you use sound to produce a image. Okay. So an echocardiograph is nothing but it's mainly just an ultrasound exam of the heart. That's what is in it. Now there's another kind of gram or graph. And again, guys, as most instances, there's again, it is a recording, but in this case, they mean still is use X-rays. But it's when we see angiogram, what is it that we mean? Yes, looking at. Yes, the blood vessels. Okay. The blood vessel then is going to be our primary interest in an angiogram is going to be the arteries. But you may have this bigger, smaller image. Where you mean yes, we'll have it the because it's the blood vessels outlined. This. Well, this was for instance just one image. But if they run image after image after image after image after image after image, which is being played, what is it that you get? A movie. So they may actually be able to get a recording or that's going to can be played as a movie. Or a recording of as the blood flow. So most people who get what you want to call it hard procedure done may first have angiogram done. Okay. Now it says, okay, for the heart, for instance, okay, for open heart surgery, so that's going to be okay, a specific angiogram that will be what we call a coronary angiogram. Okay. This coronary here is okay, it means okay from the blood vessels supplying the heart, or let's say okay, the myocardium. So to find is okay if any of these, for instance, okay, was blocked. And okay, so if it is blocked, that's mainly going to cause an okay, or narrow down. That there be okay, an area of the heart which is not getting the amount of blood that is required. So that becomes as okay, that this area of the heart, for instance, okay, here would become ischemic, or in worst case scenarios, okay, it develops as okay, an infarct. So that's how they will actually know, okay, this is the blood vessel that needs to be treated. Did you guys get that?
Yes.
No, yes, okay, how that is treated, yes, okay, we'll talk about that later on when we get to, yes, okay, another suffix or procedural suffix. But both gram and graph, yes, okay, can be used for what do you want to call it? Okay, any kind of okay as recording. Whether that becomes just okay an image, whether that becomes just okay just a graph of okay as bigger or smaller spikes.
So gram and graph are interchangeable, and graphing Grammy are interchangeable.
Yeah.
Okay.
Right, okay. Now, guys, let's take the next one. And that is lysis. We can it's okay also break up this word here and say it's okay. The cis may indicate that okay, this is a procedure process. Right, okay. Where okay, the word lie. Okay, now the meaning is okay, eat up some of it, because okay, the lie here is okay, meaning is okay, it comes from the word lice, which means okay, means breakdown. If that makes sense.
Yes.
Okay, but here it's okay, the meaning it says okay, well, okay, whether you can say okay, this last S here. This assay could be as okay from lice, and then just okay, or they merge them together, whatever. But lice means okay, just going to be as okay a procedure of breakdown. Okay. Now we can just okay, just take a couple of examples. We can say let's see one common one. We can say okay, hemo. Okay, let's do this one. Lysis. Where Megan says okay, that lysis was just going to be as okay a procedure or breakdown of, and which is going to be blood. So pretty much okay, it's a natural process that happens 24/7. Okay, now guys, what usually is okay, when we talk hemolysis, it's going to be okay, maybe breakdown of the red blood cells. Because they are continuously going to be okay replaced. So on an average, that's okay, your red blood cells have a lifetime of 3 to 4 months. After which, that's okay, they have served their job or served their purpose for their lifetime, which means to me is okay, they will need to get removed from the circulation, and that's going to happen as a result of that they are being broken down, or we can say okay, being hemolyzed. Okay, by the process hemolysis. Okay. Most of this hemolysis here happens, yes, okay, in the liver. Okay. But hemolysis may, yes, okay, just be, yes, okay, the process of breakdown of the of your red blood cells. Now, guys, as another lysis. And that's what we is okay, just called dialysis, where okay, as lysis still is going to just okay, just be as okay the same as we had here. I guess it's okay, procedure of breakdown. Now, what did dia mean?
Complete.
Completely. Clear? Okay. So yes, okay, if you look at the word dialysis, if you look at it, you mean it says, okay, that's going to be as okay, a procedure of okay, as where something is completely broken down. Right, okay. But guys, usually it's okay, okay, so that will be okay, that will be as okay what the term dialysis may mean. But when we say dialysis, that means it's okay, that's going to be as okay, a procedure. Okay. Performed, I can say okay, procedure performed on people with kidney failure. right? Now, guys, there can be two methods by which this dialysis here is performed. One is going to be what we call hemodialysis. And what pretty much happens in hemodialysis is that that's why the patient mainly will be hooked up to a dialysis machine. There's going to be the job of this dialysis machine here is to not break up the blood or do hemodialysis or hemolysis. But mainly break up the blood in the sense that it mainly separates the waste material from the blood and take it out or filter it out or do the job of your kidneys. Okay, so that's a procedure that usually can take half a day to be performed. At least that's a couple of hours. Okay, and the patient mainly will have to go to the dialysis center. Sit there by a machine as the blood goes out. It is just being run through this machine, which is going to filter it out. Or you can say break it down and breaking this down and again say let's separate blood from waste material. Well, let's separate the waste material from the blood and that's going to be taken out. Right. Oh, yes, that dialysis can also be done in another way, and that's what the VHX is called. Yes, okay. Can do it this way. It's the other type of dialysis can be what we call is peritoneal dialysis. So again, in people, still with kidney failure. But here, the person is not going to be hooked up to a big machine. Or where they mainly inject a fluid into the peritoneal cavity. Now, most likely, that fluid that is being injected is going to be what we will call a hypertonic fluid. Now, what the blue hypertonic fluid is going to be? We will talk more of that in anatomy physiology. Okay, but what this hypertonic fluid will be able to do is pull water, and with water are going to be the waste materials actually is going to end up in as the peritoneal cavity. But after as 45 minutes, an hour or so and so, that amount of fluid is meaning being aspired out again. And in that way, the patient get rid of his or her the waste material which otherwise should have been removed by the kidneys. Okay, but guys, please, 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 do not mistake, do not mess up hemodialysis with hemolysis. Okay, so hemolysis, dear guys, is okay as a natural process is going to happen in every person. Right, okay. Whereas a hemodialysis is mainly as okay, only going to yes, okay, be a procedure or process performed on people with kidney failures.
And then you said that the peritoneal dialysis is the injection of
Yeah, if
the
you look in your book, yeah.
What? Okay.
So most of those people who mainly as okay, we can say okay, candidates for peritoneal dialysis, they will have more or less okay as a permanent port or tube pass through yes, okay, their abdominal wall into the peritoneal cavity. But the may is okay, we just meet up at the clinic, they inject that fluid into it, let it stay there for okay as an XYZ amount of time. Usually half an hour to 45 minutes or an hour. And at the end of that, okay, maybe it's okay, just aspire as okay, that fluid out through that same port. But what I have been able to do is pretty much okay as due to as okay, or you can call as okay, osmosis, cause as okay, substances as okay, leak out of the bloodstream into the peritoneal cavity, which otherwise should have been removed by the kidneys and peed out. But what is kidney failure? The kidney failed. What would it mean to fail for any organ that is not able to just okay perform its job? Right, okay. What will be a failure for you guys at this stage? Not at this stage, but hopefully not, but later. Okay, guys, what is your primary job now, as far as I'm concerned? Yes, guys, say something.
Currently is to learn.
Good. And if you don't learn, what is that going to mean?
We fail.
You failed on that okay. So yes, okay. If you consider you guys as organs, okay, you have okay as one or as okay one main task. And that's going to be as okay to perform that task that you've been given. If you fail on doing so, as okay, that's going to be a failure. Clear? So, roughly speaking, the major task of your kidney is to produce urine. Right? Okay. You say what a wet and okay a stinky job. Well, okay, he doesn't complain, so yes, okay. Right, okay. So that's his job. Or you can say, it's okay, in the body, yes, okay, that's the task that the kidney has been given. If the kidney is not able to perform that job, that's a failure. That's what you call kidney failure. The kidney failed to do its job. Did you guys get that?
Yes.
Okay.
Yes.
Now, guys, the kidney's job is not only to, yes, okay, produce pee or urine. You can say, yes, okay, mainly, yes, okay, by producing urine. What is it doing? It's maintaining, yes, okay, the fluid balance of your body. Some of you may drink, yes, okay, up to 3 gallons of fluid in a day. And okay, now, guys, if your body wasn't able to, yes, okay, get rid of that fluid, what will happen? You can say, okay, 3 gallons of fluid a day, 30 days a week, a month, sorry. That's 900 gallons right there. Then you multiply that by 12. That becomes, yes, okay, the gallons of fluid that you had in a year. And then, yes, okay, multiply by, okay, as an average of your age. So right now, yes, okay, most of us, not most of us, well, that's okay, here actually is okay, being not able to fit in the chair that we are sitting. Forget about the chair, yes, okay, we're not even able to fit in the room that you're sitting in. Okay. So when is it that you drink more water than otherwise regularly?
When you're sick,
Okay. And what makes you do that?
they try to get rid of all the bacteria or whatever's causing the sickness.
Mm-hmm. What happens if you have a fever? No, you said bacteria, right? What happens when you have a fever? What do you get?
Hot.
Dehydrated.
Huh?
Dehydrated.
You said the right word, but
I said hot.
you get hot. And what happens when you get hot?
You get thirsty.
But how? There's something in between that.
Uh, you sweat.
You sweat. And what happens when you sweat? Well, okay, that's a way by which, okay, as your body may lose fluid. So, yes, okay. On hard days, you get more thirsty than, okay, as on regular days, right? And you consume more water. But that's okay. So it maintains as okay. But besides that, I probably should have done that is okay when we talked about erythro. Because guys, oh no, shit, that's not what I meant to do. Sorry. That's fine. You see, we talk and okay, yes, the more we talk, yes, okay, we get. So yes, okay, another function of the kidney is well, okay, it's not only yes, okay, producing urine. Another thing that it will produce, now it doesn't have a color. So it says, okay, the kidney is okay, will produce a substance which is going to be called erythropoietin. in. Now, if you just look at this word here, it's okay, we says, okay, it ends with in. That means it's okay, makes that this substance is okay, by nature, chemically, is okay, is a protein. Now, you see the word red or erythro here, right? So it has something to do with red. O is mainly as okay, just as okay, our combining vowel. And Puyi, P-O-I-E-T, is mainly as okay, just a word for formation. So this whole is okay, erythropoietin. It was a substance that was produced by the kidneys. And this substance here is okay, goes and act upon your bone marrow. And now if you just look at the word of, okay, as what the word erythropoietin was. Now it was going to be as okay, a substance. And what is it was going to be responsible for is, what we mean is, okay, just we'll call erythro. O. OE. And we can then say it's okay, cis. And what would that be? A process of formation of red, the red word, blood cells, because that's going to happen in the bone marrow. So yes, okay, as your body is performing hemolysis, breakdown of your red blood cells, they got to be replaced by new cells. Where are they going to come from? The bone marrow, right? Okay. How would the bone marrow? The bone marrow doesn't know that, okay, yes, this and this and this and this many cells are being broken down. Or it's okay that you may be running low on red blood cells. There's something that your kidney detects. You can put it this way. And as it detects, well, okay, we need some more red blood cells. It will produce erythropoietin. It's chemically, it's okay, looking at it, it's okay, protein, but physically, it's mainly going to be, it's okay, a hormone. It's going to be a hormone produced by your kidneys that acts upon your bone marrow and childhood. Okay, you know, buddy, we're going to just okay be in a dire need for some red blood cells. You better get busy. Okay. Not just hemolysis, that's okay, you, God forbid, you have a massive bleeding or so. So guys, everything in life is, if you look at it, this is all about balance. Because hemolysis just went out with no replacement, sooner or later, okay, you are going to be actual anemic. No red blood cells left, right? Did that make any sense?
Yes.
So the pouilly, I think it's a French word. I don't speak much French. As a matter of fact, it's okay, I don't speak Any French except merci and bonjour. And maybe it's okay, just bon appetit. And that's it. I guess that's the only French I can say. I know so little French that I don't even know how it's okay to say a few curse words in French, though. Okay. Okay, guys, what else can be broken up? We may need that for the season that we are going into.
Fat,
Huh?
fat, lipid.
That? Okay. Why do you need to break up fat in the season now that we are going into?
To keep us warm.
It's probably not going to be the breakdown of fat that will keep you warm.
Oops.
The fat, my dear, is an insulator. So it prevents the loss of heat from the body. And that's what keeps you warm. Okay, guys, what season are we going into?
Fall, winter.
Oh, you already are in fall, my dear.
Oh, winter.
Oh, shit. Winter. What usually happens in the winter?
It snows.
Okay. I hope not. I don't hope it's going to snow. There have been winters where it didn't snow, so okay, yes, that's not a must.
Just cold.
Gets
It'll be
cold.
It's cold, okay, and what happens when it gets cold?
People get sick.
Okay, what kind of sick?
Like
cold.
cold.
Flu.
Cold, flu, and what happens when they have cold and flu?
Produce
With flu?
more white blood cells to fight the
Okay,
infection.
okay. With flus comes phlegm, right? And what do you need then? Now, we're not going to be using the word phlegm, but a more common word is going to be as okay, muco. Where we can mean says okay that this muco here actually is okay, it came from the word mucus. And mucus can actually it's okay be what you call phlegm or become flame or phlegm. Now, what is this mucus or phlegm going to be?
Isn't it just postnasal drip?
Okay. Guys, in nature, it is going to be thick. So that thick mucus is going to be too harsh on you to cough up. So what would you need? Next time you go to the pharmacy, no.
Decongestant.
Ah,
Like a what is that? Mucus D Mucinex.
Mucinex. So what is Mucinex? It's going to do something to that mucus that makes it easier for you to
Gonna break it up.
It loosens it.
break it up. So that substance that's going to just break up the mucus, which is thick, and when it's thick, we call it phlegm. It's going to be mucolytic, which means just means breaking a substance. That's that's going to just break up the mucus. Where the process means it could just be called as mucolysis. So it breaks it up, make it just from thick to thin, which is going to just make it easier to cough up. So you don't have to cough your lungs out. Just get some phlegm loose. Now, guys, God forbid it happens. And you don't have anybody just go to the pharmacy for you to pick up some Mucinex or something. And you're too sick yourself, and it's too cold out there. What can you do?
Boil hot water and like sand
Yeah.
over the steam. Okay.
Okay, you can inhale that. What that's most anti-malaria just going to be good for. You can say it's your sinuses and stuff. Just drink lukewarm water, not hot water. Lukewarm water actually is it's you can say it's with the best mucolytic substance.
My grandmother used to have us like gargle warm salt water when we were younger.
Yeah. Now the salt water, my dear, that's more for you can say it's for the congestion and things like that. The swelling and so and so. Because well, you may say it's the salt, that's the warm water may do it, but what actually is it takes, or it's help you get rid of that congestion is the salt. Because as I said, what is it that salt does? Well, it's fluid. So pretty much what mainly causes most tissues in your body is be swollen. Or you may say cause congestion because they're swollen up with fluid. Where did that fluid come from? Your blood. So then when you go and say, Epsom salt, for instance, why would some people, like to, soak their feet in, Epsom salt? Because they have swollen feet. So what did that salt do?
Pulls it out.
Pulls it out. But that's all, something that we will talk more of, and in anatomy physiology. Okay, guys. Now just take your lunch break. And would it be fair that I see you guys back at 1 o'clock?
Yes. Thank you.
Okay, then have fun till then. Let's get back. Okay, guys, and so we can actually say that as now our next term is plasty. If it means it's okay, the word or the letter Y here means yes, okay, just indicate that will be yes, okay, well. Procedure of plastering, right? Which did mean yes, okay, or mean repair. Most likely, yes, okay, this repair here is going to, yes, okay, be surgical. Okay. And it's mean, yes, okay, from this plastic here that we get the word plastic. Okay. That you hear is okay being used in plastic surgery, for instance. Because this plastic here, the ick is me is okay, just pertaining to plastic or repair. Okay. Now, guys, we have already talked of rhinoplasty, so I don't. Okay. We can also say as okay something as okay as mammoplasty. And what I mean is that okay back then was okay the primary purpose of okay as breast implants mainly as okay was to okay you can say reconstruct or repair or as okay remake that's okay something that looks like the breast and which is not there anymore due to yes okay mastectomy. So mean yes okay just to give the woman yes okay those feminine curves back if that's what you want to call it. Now there's one plastic here, yes okay, that I will talk about. And now earlier we said something that we call is okay, we call it an angiogram. Okay, which mainly is okay, would just have been as okay, imaging test on yes okay, let's say it's okay, your blood vessels. But okay, as it can be run as a film. But what you mean is okay, we'll see in an angiogram, irrespective of yes okay, what is going to be as okay, it's going to be as okay outline of your of the blood vessels of which yes okay angiogram was taken. Now one kind of angiogram which is of okay, it's like a clinical importance and it's very commonly performed is going to be as okay a coronary angiogram. But this means yes okay going to be yes okay from yes okay the coronary vessels. Out of the coronary vessels, the blood vessel that is actually is okay of our real interest is the artery. Where we always okay know that okay in most instances okay when we said that we'll use the word angio, that is going to be the artery. Now that is to say that okay as a result of our angiogram we is okay mainly is okay found out that let's say it's okay this blood vessel here was narrowed down or stenotic in one way or the other. Now comes just okay, how do we correct that? How do we repair that? Now that can be two ways. One way is, well, let's say it's okay that this was okay as our network of blood vessels that we had. Okay. Okay, let's go like this, and let's say it's okay that we had a narrowing here. or a blockage. That may cause that, okay, as all this area that was supplied by this blood vessel here, okay, may become ischemic. Now, there's a procedure that is known as CABG. Essentially, that's okay, you say that this was okay as your coronary circulation. Where the C is mainly as okay for your coronary, A is for artery, B in as in boy is mainly as okay what we call it's okay a bypass, and G is for grafting. So coronary artery bypass grafting. And what the mainly as okay will do, and okay as what you can call as okay coronary artery bypass grafting, is they may take a blood vessel from anywhere. Now that depends. Usually it's okay. They may take a vein, attach one. Okay, let's choose another color. Attach one end of that vein here, and the other end of that vein here, and like this. And what happened? Well, okay, yes, the blood that couldn't run here because of the blockage is redirected this way. And you can say, okay, now this whole area is not just okay be reperfused. So that's pretty much okay. As well, okay, pretty much that you can say it's okay. The simplified way of just okay how they do grafting, or it's okay run what they call a bypass by a graft. Now this graft could either be a vein, okay, or that's okay. This may actually is okay come from another artery somewhere else. It means okay, just going to bring that end of that artery beyond the blockage. I mean, that means okay, we'll just ensure that okay, this area is going to just okay be reperfused by the blood. Clear? Now comes the other one, and that's okay, yes. What we mainly is okay, we'll talk of. Now we may have okay, yes, what they call as okay, angioplasty. The angio, of course, that's okay, is going to it's okay be for the artery. We may go and say it's okay, plasty, which means it's okay, will just be as okay, the procedure of repair. But let's just say that okay, yes, this was our blood vessels. We had okay, yes. And let's just, okay, to do this is, okay, magnify this and say, okay, if this was our blood vessel, we had, okay, yes, it was narrowed down. Most likely, yes, okay, due to, yes, okay, atherosclerotic plaques. Okay, now what they may have done in this case here is, okay, will be, as okay, something that they, okay, still will, yes, okay, just call it, okay, and angiography. That's it, okay. Or they may even say it's okay, angioscopy. At the main is okay with okay as with a scope. Actually, that's okay. Go inside the blood vessels and runs the neck. Okay, say well, okay, here we have a narrowing. Now comes just okay your angioplasty, where they have located the narrowing, and mainly as okay just start with the plasty. Okay, as a tube is going to just okay be inserted into this area here. Now, two things. Now, back in the days, that's okay. this end of this tube here means, yes, okay, just had a balloon in it, which means, yes, okay, will just get inflated. And as it got inflated, it means, yes, okay, will push up against the vessel wall here. And mainly, yes, okay, cause it to get distended like this. Okay, well, okay, we still, yes, okay, had the plaque. We still have the plaque. But at least what we can say is conscious, okay, the end result is, okay, yes, that the vessel opened up. So that, okay, yes, that obstruction that the blood flow was experiencing is, yes, okay, removed. Okay. But, so that's mainly, yes, okay, what, yes, okay, they still, yes, okay, back then they called this, yes, okay, angioplasty. Okay. But later on, we mean, yes, okay, just call it, yes, okay, a balloon dilatation. Call it, I mean, yes, okay, just that balloon that was inflated, I mean, it's okay, just dilated the blood vessel. What they found was that, okay, this area here was going to, yes, okay, tending to, yes, okay, still, yes, okay, build up, and okay, yes, a new plaque is building up. And now you really can't do much because, okay, we keep understanding this blood vessel, it may pop. So that's when they start saying, okay, just doing a balloon thing is not enough. So that's when it's okay. What the mean is okay did was, what you mean is okay also is okay. You can see in your book. Is well, okay, we had this plaque. Let's see, okay, let's do this way. Sorry. We had a blood vessel. We have a plaque. Which is going to, okay, cause this blood vessel here is okay to be stenotic. Okay, now this is just okay, what we nowadays just okay call an angioplasty. Well, okay, yes, that's still going to be this thing here. Is okay, we still has okay that balloon that can be inflated. But what we actually is okay have around here is going to be as okay what they'll call a stent. And stent, yes, okay, may sound crazy, but it's okay, mainly yes, okay, may look like something like a fence, a metallic fence, or net. That okay is actually is okay is distended as that balloon is being inflated. Which means yes, okay, we'll push onto yes, okay. And what we actually is like end up with okay, that the blood vessel is going to yes, okay, slightly like this. We still have the plaque. Okay. But what happens as a result here is okay, yes, that is pushed aside. Okay, yes, but once yes, okay, that balloon is taken out. It's kept open or remains open mainly yes, okay, because the stent is left behind. And the latest technology in stents is that okay, as they are what they call medicated stents. That stent actually has a code of medication upon it that's going to prevent further buildup of plaque. Otherwise, it's just going to come back and the blood gets stenosed again. Okay, so before that's okay, they mean yes, okay, we'll just use a balloon to dilate the blood vessel. Now, some of you may be scratching your heads and saying, Mike, why can't they just do yes, okay, an atherectomy? Removal of that plaque. Mainly because, guys, okay, as those blood vessels that we are talking about here are super, 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 super small. Okay. or they will be as okay too small to as okay actually as okay to be able to as okay run and or as okay perform an atherectomy on. At least that's what as okay that's where our technological abilities are right now. Who knows? Maybe in 50 years from now on, yes, okay, that will become the common standard. You never know. Or maybe it's okay, they are able to just okay come up with a drug that will be able to just okay go in and okay yes destroy us okay or blood clots or things like that or plaques. Never say never. Maybe some of you could be as okay one of the pioneers in that process. Don't say me, no, I'm a failure. Okay. If I'm able to do this course, okay, this is more than enough. Okay. So that's okay, things change. Okay, meaning because somebody says, okay, that's okay. What we have now is good. But maybe it's okay, something else can be better can be done. Okay. So that's pretty much okay as what they call an angioplasty. Did you guys get that?
Yes.
So first there was just a balloon, boom, 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 boom. Later on, it said, well, okay, balloons may not, it may just temporary as okay, a temporary solution. But then eventually that's okay, the patient still might have to just okay undergo open heart surgery because it narrowed back again.
Do they leave the stent in or do they take it back out?
No, that remains there.
Okay.
They leave it. Now it may sound okay a little bit aggressive, okay, why would they leave as okay something that looks like uh, a metallic fence or barbed wire inside the blood vessels. While okay, if that's what it takes to just okay help the patient, why not? Okay, so yes, okay, the stand is left there because that means yes, okay, just left there as okay as in the standard form and actually is okay preventing the blood vessel from going back. Okay. So it's okay. That was mainly it's okay. Two things that could be done. It's okay. A bypass grafting, or you can say it's okay. Angioplasty. Okay. That first angioplasty was just balloon dilatation. Now it's balloon dilatation with most likely it's okay. They will give you a stent. Okay, guys. Any questions about your chomies?
No.
Good. Good. Then let's just talk about, okay, sorry guys. Let's just talk about, it's okay, what we call stomies. And okay, as well, okay, stomy mainly is okay because it's okay, it would be an opening. But the reason that they call it a stomy is mainly it's okay because it comes, that's okay. So the Y here is meaning it's okay, just meaning it's okay, that is going to be it's okay, the process or procedure. Okay. But the reason that they call it stomy is mainly that's okay from the word storm, which actually is okay derived from stoma. That means mouth. And the reason that we call this whole thing here is okay as stomy is because it is going to be as okay mouth look-alike opening. Did you guys get that?
Yes.
Now, guys, that's okay. The common area of the body, that's okay, where they may make a stomy like that would be the abdomen. So let's say that, okay, if we're just going to make us like a couple of stomies at different locations. Because that's okay, hypothetically. For instance, like this. Now, what we mainly as okay can say is, okay, if this stomy here, or if the structure that open up or leads to this end of stomy here is going to be as okay, the colon. Then this is going to be as okay, a colonostomy. There's a colon here, is okay, mainly is okay from colon. And the stomy is that mouth look-alike opening. And what the main is okay will just do is okay as place okay as stomy back. And now mean yes okay constants from the colon yes okay we mean it's okay collecting this back here. But the reason that we call it a colostomy is mainly because it is an end of the colon that actually is okay leads to this opening here. Did you guys get that?
Yes.
Okay. We can say as okay, we may have okay as another opening here, for instance. Okay. So this is still going to be as okay some sort of stomy. But we may say as okay that the structure from the abdomen that is okay leads to this stomy here or to this opening here. We could say as okay or have been as okay the friends there's okay could have been the ileum. Now guys, okay, if you just remember as okay from the other day that okay as the ileum was okay meaning it's okay just a part of your small intestine. But mainly because it's the ileum that opens up into yes okay this mouth-like opening here or the stomy. That's why it can just be referred to as a ileostomy. Okay. We can have a similar opening. Let's just say that okay, as we have a similar opening, this one here. Now this is again yes okay going to be yes okay a stomy. But mainly because yes okay the structure that opens up into this stomy here is okay was your was your jejunum is again yes okay just for okay as a part of your small intestine. Then this opening here is okay maybe just call it okay a jejunostomy. And just it's going to be jejunostomy. Did that make sense?
Yes.
Yes.
Good.
Yes.
Okay. And well, okay, you can go on. You're gonna say yes, okay, what if okay, we still yes, okay, we'll have this stomy here. And let's just say that okay, as the structure that opens into this fellow here. First is okay, wash your stomach. Now we already know that, okay, the word for stomach is gastro. But this is going to be as okay as stomy, and mainly as okay because the stomach opens into it is going to be as okay as gastrostomy. Did that make sense?
Yep.
Yeah.
Right, okay. Now, guys, most of these stomies here is okay, maybe only temporary. Okay. Okay, it's not necessary that, okay, the patient will have to live with, okay, as this stomy for the rest of his or her life. Okay, you may say, yes, okay, that would be the case if, okay, as whatever part of the gut in this instance, yes, okay, that was beyond or came after what became, yes, okay, the stomy has been removed. Then you can't put it back because this is the end station. Right, okay, unless, okay, yes, for other cases. Okay. Did that make sense? Okay. So when they, for instance, say it's okay, well, okay, enough with this to me. It's about time to just, okay, put things back to, yes, okay, the way that it were. That's going to be a process itself. Clear? So what do we call it? Let's just say, okay, guys, let me just take it here. Let's say, for instance, okay, this was the abdomen. Let's say it's okay, we had a stomy. Okay. And, well, okay, let's just say, okay, the structure that was attached here was, okay, as part of the colon. That's going to be as, okay, the part of the colon, which actually is, okay, has, which is, okay, have this mouth opening end of the colon, opening up through this stomy, and just this whole thing becomes just, okay, a colostomy. You can mainly say, okay, remaining part of the colon is in the abdomen. Okay, what they mean is, okay, we have done at that point was sutured it, closed its mouth. Now comes that's okay, yes. The remaining is okay, we'll just join this part of the colon with this part of the colon. That process of, you can say, it's okay, here it's okay, joining 1 to 2. That process is going to, it's okay, be referred to as an anastomosis. Did that make sense?
Yes.
Okay, so the process where we're going to join 1 to 2 together is going to be as okay, anastomosis. But you mainly can say, well, okay, yes. What okay, yes, will do is okay, yes. So okay, let's remove the colon from this part here. Now we have a colon with an open mouth. We can do it this way. You can say, okay, we had, okay, it's a piece of colon where, okay, yes, that piece of colon, yes, okay, had an opening. That opening was first leading here. We had a piece of colon whose mouth had been sealed or sutured. That's okay. those sutures may be open, and what do we end up having now then? It's other piece of colon here also is going to have a mouth-like opening. Did that make sense?
Yes.
Good. So what do we have now? Two mouths, and they're mainly as this whole process of anastomosis mainly as just apply suture, 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 suture. And those are going to be brought together. So that's that end of the colon, this end of the colon, which both had their mouths are brought together. And that would be what you call an anastomosis. Brought together in a way that is going to be sealed with a kiss.
So it'll just heal itself and become one tube again?
Exactly.
Okay.
Okay. So it's just going to be mouth here, mouth here. Sutures, what are the sutures? They're just going to pull on those sutures and bring those pieces of ends close together. And those two mouths are as speaking says together like a kiss, and that's how it's going to heal. But that whole process of as closing those mouths with with a kiss is going to be what you call anastomosis. Did that make sense?
Yep.
Good. Okay. And then you can just in your book see that they have different kind of anastomoses. In my book, it's figure 320. End-to-end anastomosis. Okay. End to side and side to side. Now, guys, yes, this is what I'm talking about. Let's clear off the light here. You can see this? Okay. So this one mainly is used to me. This is as your anastomosis. Okay, so this is end to end, what we just talked about. In some cases, that's they may join a structure, not from the end, but as to the side. Usually it's when they do is bypass procedures, it's going to be this kind. Okay, there is somebody ask about gastric bypass and so on. So, okay. And then there's going to be this kind here, which is going to be side to side anastomosis. And guys, that's just going to sorry. Now I may take a little jump because yes, or may talk of something that you may not just directly find in your book. Guys. And that's going to be because we will talk of two terms. Sinus versus fistula. Okay, guys. Okay, guys, now what the word sinus actually means. That's okay, it's from the Greek, okay, Latin word that actually is okay, means either hollow or bay. Okay. And that says, okay, way is okay, you can say it's okay that your sinuses got their name from because, okay, they are hollow spaces in your skull, or mainly it's okay in your craniofacial skeleton. Okay. And what a bay when me is okay is that, okay, they are blind-ended. That's okay, that means it's okay going to, it's okay, just be open at one end. But at the other end, yes, okay, they're going to be blind-ended. Or yes, okay, just like a street, yes, okay, be a dead end. Did that make sense?
Yeah.
Good. Whereas fistula, now I think we talked of a fistula earlier, right?
Briefly. Yeah.
Of course, it was briefly. Okay. Now, guys, what is going to be a fistula? Now, guys, fistula mean is going to be as okay. We can say it's okay. It will be a connection. Now, here's going to be as okay a connection between. Now, there can be two possibilities. Okay. Okay. For it to be called a fistula, it can be as okay a connection between structure and structure. We talked about that example earlier when we said, okay, yes, the bladder, for instance, and the colon. Right, okay. That connection between these two was going to be as okay a fistula. Where one structure was okay, as you could say, as okay, what had been yes, okay, your bladder. In this case, yes, okay, the other structure would have been your colon. But that connection between yes, okay, the two structures here was going to be as okay, what you call a fistula. Did that make sense?
Yep.
Yes.
Good. Now, it could also be, it's okay, again, it's okay, a connection between. Now, what is it that we have? It's okay, we can say it's okay, a structure. Any organ of the body, not anybody, that's okay. Okay. And what is that going to be connected to? Yes, okay. The environment. Or we can actually say, it's okay, where it becomes, yes, okay, through the skin, yes, okay. Through the skin. But it's okay. In that way, it's okay, is going to be a connection between the organ itself and, okay, yes, the external environment of the body. So, guys, that's okay if a passage can develop between colon and what you want to call it, okay, bladder. Now that guy, as we said, okay, that this here, for instance, okay, was, for instance, okay, the colon. And this, for instance, okay, here was the bladder. Now, as okay, it is going to be called, okay, so this connection here is going to be as okay, the fistula. Okay. But. Colo is going to be for colon. And the term that's going to is okay represent bladder in this case is not going to be cyst. But maybe that's okay, there's going to be another word which is going to be vesicles. And of course, it's okay, we will have, this is okay, O as our combining vowel. Okay, this vesic or vesic actually is okay, comes from vesicle, which is me as okay, just another as okay term for okay, as a structure that may as okay be made of okay, as a covering membrane, and okay, it will contain a fluid. Did that make sense? We can say guys that there will be as okay another example of a vesicle of a fistula, sorry. By as okay here where actually as okay, and that can be as okay a bit of as okay pain in the butt. And we actually it's okay, we'll call it the tracheo. Esophageal fistula. Now you can see as okay, what is that going to be a connection between? Well, okay, as your esophagus, through which as okay, goodies like food and so on so may pass. But that's okay in front of okay, as the esophagus, at some point, as okay, you also have okay, your trachea. And if there's not a connection between these two, what may happen? Food which actually is okay, should have just passed down the esophagus may go into the trachea. And okay, as now the patient may be choking. Did that make sense?
Yes.
Good. Now, ladies, oh, sorry, guys. Some fistulae, now these were all that's okay, abnormal fistulae between that's okay, body passages. But it's okay, we may have a fistula that actually is okay, may have to be constructed. Okay. And that is going to be as okay, a fistula between this, which would be an artery. And yes, okay, the other kind of blood vessel, which would be a vein. And here is okay, the actually is okay, I'm going to okay, artificially is okay, make a connection between the two. Now this kind of fistula here is okay, can actually is okay, be abbreviated as A, V, and okay, here it's okay, my fistula is green. That A main is okay, that's going to be arterial. V is going to be venous pertaining to the vein, fistula. Now, some of you will go, it's okay, why would somebody need something like this? An AV fistula. Now, earlier today, we talked hemolysis. No, that's amylolysis. Hemodialysis, sorry. And people who, yes, okay, have to go for, yes, okay, hemodialysis, being hooked up to that machine. That's going to be, yes, okay, at this junction point of, okay, as this AV fistula, which has been, yes, okay, surgically produced. Did you guys get that? So you guys may say, well, okay, so far we have only talked about, yes, okay, fistulae that run between structure to structure, structure to structure. What about fistulae that, okay, as may run from a structure to the outside or through the skin and connect to the outside world, right? Now, someone who says, okay, isn't the mouth a fistula? No, that's normal, right? To have a mouth. It would be a problem if you didn't have a mouth. You may say, what about your nostrils? What about your ear? What about your butthole? So on so. Okay. So, guys, now, yes, okay, if there can be, yes, okay, a connection between your bladder and the colon. Of course, guys, that can also, yes, okay, be, or somebody may, yes, okay, also develop a, yes, okay, connection or a fistula between the bladder and the skin. Most likely, yes, okay, if that happens, yes, okay, it's going to be, yes, okay, on the front side. So that's going to be, yes, okay, now referred to as a vesicle. Okay, yes, okay, from bladder. Cutaneous for skin. And of course, yes, okay, that will be, yes, okay, fistula. You guys get that? So what's going to happen here? P may, yes, okay, leak through this fistula, through this opening here. So guys, okay, there's one last fistula that we can chalk off. What we mean is, okay, here in the middle of the head is going to be, says, okay, anal canal. But yes, guys, there's something like this that actually is okay for some, so the person may actually. And please keep in mind, okay, as this is going to, yes, okay, you'll be able to just, okay, close this hole here. But it's okay, what may happen then? Now, like a fecal material may leak out because there's an opening. So what do we call this kind of fistula here? Fistula in anal. And yes, okay, that's something that actually is okay, can bring sweat. Okay, yes, a surgeon's forehead. Because how do we treat that? You can treat it, but there's a great risk that the patient may become, yes, okay, permanently fecal incontinent. And before it was just, okay, a little bit of poop that would stain. And if you become a fecal incontinent, what happens then? Okay, yes, you have no control. So, yeah. Should we talk therapy? We already did therapy, okay? We said radiotherapy. What was that? Using radiations for treating off
Cancer.
cancer. Right, okay. We said chemotherapy. Well, okay, if you look at it, it's okay, mean treatment with drugs. So every treatment will be chemotherapy, but the word chemotherapy is significantly, specifically as okay, used for as okay, treatment of with drugs for cancers. You taking a Tylenol is not chemotherapy. If that was the case, then okay, all of us would as okay, be as okay, suffering from cancer, and then headache would be as okay, a deadly disease. Right? Yeah. You can say it's okay, from therapy comes just okay, therapeutic, which means okay, just pertaining to therapy or pertaining to treatment. Okay. And then you get says okay, therapeutic dose of a drug, and then okay, as a toxic dose of a drug. So what will a therapeutic dose be? That will be as okay, the dose of that drug that is okay as used for treatment. Okay. 2 tablets of Tylenol. Whereas okay, the toxic dose will be as okay, 500 tablets of Tylenol. Don't take it. It's not going to kill you instantly if that's what you try to do. So how will it kill you? Slowly and painfully. Because first your liver gotta fail. But that's okay, as that's what the Tylenol easy can do. It can smash your filter. Oh, sorry, liver, sorry. Then we say it's okay, cryotherapy, where cryo was. I talked about that yesterday. What was cryo? Cold.
Cold.
Or where we actually is okay, in this case is okay, use extreme therapy, extreme cold, not extreme cold, but it's okay, temperatures which are cold enough to actually it's okay. Because it's okay, kill the cells. Mainly it's okay, used for things such as skin warts. Okay. But then you may say, well, okay, I have a skin wart right here on my cheek or something. Why wouldn't they go with that? Because okay, that actually that's okay. There's a great risk that okay may cause damage to your face. So maybe that's okay in other areas okay that are not shown. Okay, but you say, well, okay, I have this big wart or mole or whatsoever that I want to get rid of. Okay, okay, you may let's okay like to talk to a plastic surgeon for that one. Now, is there anybody who don't like moles?
Like skin moles?
Yeah.
Not impartial.
Okay. Do you guys know that in some places, that's okay, moles are considered signs of beauty? Okay. So they'll say, okay, that's a sign of beauty. That means that person is okay. And then we have as okay, one last kind of therapy. Okay, of course, it's not written in your book because, well, it's not some therapy that I made up. I may tend to make up things like Angelina Jolie and Brad Pitt being surgeon or cardiologists, right? Okay, but you actually had the word, that's okay. Therapy in it. Couple therapy. And that's usually something that, okay, yes, women suggest. How? First of all, the crying therapy. Okay, crying. To just, okay, tries to convince us, okay, the male partner that we need to go for couple therapy. Okay, but that crying therapy is not going to be cryo. Okay. Okay, guys. Then, okay, as I guess, unless somebody has a last word of wisdom. A punchline from the TV show that they watched last night. I woke up in the middle of the night. No. Nothing. Okay. Then I guess, okay, I will see you guys tomorrow. With what day is it tomorrow? Thursday?
Friday.
OMG. Friday or shit. Okay. Then Friday it is. And you guys are aware that you are off on Monday, right?
Yeah.
Yeah, okay. Columbus Day or what the blue they call it. Okay, that's fine. See you guys then. Have fun till then.
Thank
Have a
you.
good
See you
afternoon.
tomorrow.
Bye.
Bye bye, guys.